So Stefan Hartmann here, Iron Direct Primary Care. I'm with my mom here, Lynne Hartmann, and Dr. Peter San Pedro. He's a physical therapist and friend of mine. And mom here is going to kind of explain what she's been dealing with in her back and what she learned recently from watching you watched some ELF videos of Brian Johnson. Brian Johnson had some crooked back syndrome, leaning over, and he figured that was actually impeding some of his circulation and physiology. So that a little light bulb went off. You're like, I need to address this. And so you can tell Peter what you've been dealing with, and Peter can tell you how we would fix this in physical therapy.
So, Peter, I don't know, since I was maybe 40, I've had a back pain in the afternoon, and if I laid down, it went away. And so back, I don't know, in 2005, I Googled it, and Google said, if you have mid back pain, you have pancreatic cancer. So I didn't Google anymore because that was terrifying, and I knew I didn't have cancer. I've thought perhaps it was better if I didn't eat carbs, and I've tried stretching. I do weightlifting. I have a roller. I roll on the floor and I feel a good crack and it feels better. But then, as Stefan said, I've been watching Brian Johnson's videos, and he said, and he's always standing up very straight, and he says it's the most important thing he does. And then I saw some ads for an elastic brace that helps you stand up straight, and I looked at the Amazon reviews, and people said their back pain went away. And I bought it, and just a couple days now, I think that is the whole issue. This whole stupid back pain has been, I haven't been standing up straight. I can't believe I've.
And how long has this been going on for?
At least 20 years.
You said about 20 years, huh? So, there's a lot going on at the back. You've got 3 different sections: cervical, which is the upper neck. You've got thoracic, middle of the back, and lumbar, which is your lower back. So there's 3 different regions, lots of problems going on, but the back is a very stable part of your body, is what I typically tell my patients. In females, sometimes you can see a lot of that upper back pain. Larger females, they have bigger breasts, so they'll hunch over. And you'll get a lot of upper back pain. That's pretty common. But a lot of what I see in the clinic in terms of back pain is mostly just due to either weakness or something you're doing daily during the day. You said yours comes on mostly with standing. So maybe you can elaborate some of your pain triggers. That way I can get a little bit more insight. Does it get better with walking or movement? Or do you find that any movements help alleviate it?
Mm-hmm. It gets worse if I'm sitting or standing. I've noticed if I have to pack a lot of my product to send to Amazon, and I set them all out, and I've just got to do it. And after a while, it'll be like a knife pain in the back.
And it's right here, just like along the upper back here?
Nope, middle.
And it radiates out to the side like that?
No, all along.
Got you.
All along the middle. And if I lay down, poof, it's gone. What helps it is laying down or rolling on that foam roller on the floor. You roll.
Once you kind of get it opened up?
Yeah, I feel this nice crack, and that feels better.
Yeah, well, I like to do that too. With I had a patient this week with some thoracic issues too. That's typically one of my first go-tos. A lot of people, for whatever reason, due to tightness or hypomobility is what we call it in the PT world, we've got the chiro next door. They can do manipulations to kind of open up the upper back. And have you had any experiences with that, or any kind of manipulations or cracks before? Have you ever done any of that?
I went to Chuck. He's a really good masseuse up in Cocoa, and it felt really great going to him, but it didn't solve the problem. It came back.
How long after?
I mean, my spine felt so good that day, but I suppose by the next week I was back to my usual pain.
And then you get that same effect whenever you get on the foam roller as well. Like it'll just alleviate for a little bit and then come back.
Yeah.
Yeah. So very interesting. Okay. Perfect.
It's so unnatural for me to stand up straight, but I'm gonna try to do it now.
Yeah. So there's a lot of things that could pull you forward too. Like a lot of the upper back can get hunched over.
Yeah,
what hunches people over is tightness in the front as well. So your pecs attach up at your shoulders here. But right now I'm just going to kind of show them the back and just kind of see what's going on so they can actually see your pain, because I want to make it visual they're probably watching through some kind of social media platform. So just to give them an idea. So we'll rerun it from the top. So I'm just going to kind of explain the 3 sections here. So Miss Hartman came in. She's got some upper back pain.
Yeah, middle back pain.
Yeah, right here in the middle of her back here. So I was discussing before, you've got the cervical spine, right? There's 7 vertebrae right here that come right about down to here. C7 is the last one. Then thoracic kind of comes through here. So that's your mid upper back, and then lumbar. And you're trying to stand up straight right now for the camera. So a lot of what can happen at the upper back is you have a lot of people who are on their feet for a long time. So they get either stiffness or, most people in the world, they're working in front of them. And you can already see how my posture is going out like that. So, I'm really big on strengthening through the upper back to help promote this posture here. And then depending on what the athlete or patient has got going on anteriorly or in the front of their body, there can typically be a lot of tightness here at the shoulder, the pec, that will round them forward and pull them forward into this kind of posture. So, it's hard to say off of, we just met right now exactly what's going on too, but I'm going to just go ahead and feel everything out and kind of, you let me know if there's any kind of tightness through this region. So you said it was kind of off to the side, huh? And in this region too, you've also got the scapula. You have 2 scapulas here that they also work with the shoulders and rotate things up. So the first things first, I'll have you show you here. Can you just kind of lift your arms up overhead? And then do you have any pain with like overhead movements or anything like that?
No, I'm really flexible. I have a lot of flexibility.
And then let's go back down for me. You can put your hands back down. It looks like her shoulders actually move full range. So, typically with a lot of thoracic spine stiffness, people will have a lot of issues getting up overhead. So I'm trying to figure out, whether or not right now this is something that's either muscular going on here or if there's something actually going on at the spine, if there's some stiffness. So what I want you to do is we'll have to switch the angle, but I'll get you on the table and then I can just kind of look at the spine and kind of gently push on it, see how the bones are moving in there, see if there's some hypomobility. And then from there, we can kind of give you some exercises and things to do.
Very good.
Yeah, perfect.
I once went to a orthopedist in Berlin after I gave birth to Belle, and she was like, "Oh, lean over," because she was expecting me to be stiff.
Yeah.
I'm really flexible.
What would you say the pain is like out of 10 when it comes on? Is it like a 0 being no pain, 10 being you got to go to the hospital emergency room kind of deal?
It's like a 3, then I'll go lay down. I mean, my business is flexible. I can go lay down and then it's gone.
It's like an aching pain.
So I only notice it a lot when I have to stand up. I have to get my product out and I'm standing for 2 hours. I'm sitting and I must be slumping. And then it's like a knife. And then it goes up to like an 8.
Once you're on your feet for a while?
Yeah.
Mm-hmm.
Yeah.
Interesting. Let's get you on the table. I'll just take a look. I'm going to go through like the kind of textbook evaluation so that people can kind of see how this kind of looks like. But, after hearing her, I mean, it doesn't seem to be like too pressing of an issue. So I'm just going to gently kind of come along the spine, just kind of push down and see what's going on here. And it looks, there's a good bit of recoil. So, your spine moves pretty well. You're not, some patients I've got that come in the clinic, I push down on the spine and there's no give. Mm-hmm. And they basically are rigid. They're locked, they're rigid. And for them, getting more mobility is typically pretty helpful. So any pain with that when I kind of push on your back like that? Any issues or anything like that?
No, feels good.
Great. I'm going to dive in deeper. I'm going to kind of come off of the side here and just let me know if you feel that referred pain. Okay. Just kind of working around the muscles here to see if there's anything that any kind of that referral pattern that you typically see.
No.
Good. So first things first, just ruling out the back. And then you don't ever get any symptoms into the arms or anything like that?
Correct.
Good. Off to the side here, anything here?
No.
So the back feels pretty good, believe it or not. Like in terms of nothing here to produce her symptoms. It just seems like standing. So it seems like she's got a lot more issues with going into extension. So the best way to kind of reverse that and what I would do, taking the treatment approach with a little bit of time that I have here is I would probably give her some exercises that are going to pull her out of that extension, which is causing her pain. Standing like this, your back is in a little bit more extension and kind of get her into flexion to kind of open her up. And based off of what she was saying, that's the direction I would probably go. So here's what we'll do. I'll have you sit at the edge of the bed for me too. Let's just see how you rotate. Does this? I guess we can keep. We don't have to keep. Does it kind of go down a little bit or? Oh, perfect. Okay, perfect. So let's just see. I want you to kind of come here with your hands here, and then I'll have both of your feet straight, just relaxed. Yep. Can you rotate here? Any pain or anything?
Feels good. It might be a little tight here.
So a little bit of tightness on the right side there, but that's lower back. That's not typically where your pain, or is that like that referred pain that you mentioned?
The pain would be here.
Good. So we'll come off of that. So not too much pain in that region, but some lower back pain. Which she's in a pretty exaggerated stretch. Let's go to the other side.
Same thing. A little tight there.
Good. I'll have you stand up for a second. Let's just look at your motions real quick. Are you able to kind of come down and touch your toes?
Oh yeah, I'm real flexible.
Good. And that probably feels good.
That feels great.
And then let's come up for me. Now, are you able to lean back without, or does that bring on your symptoms? Movement's great.
Movement feels so good. Yeah. It's just standing and that's bad. I'm really flexible.
Let's get you seated back down. Let's look at the legs and see the strength here.
Okay.
And then I'm gonna grab that.
Yeah, I need muscles. I know that.
Perfect. So I'm gonna do some manual muscle tests just to kind of see where she's at. I'm just going through a standard screen. Nothing too crazy. We have our tools, right? Trying to figure out whether this is either a stability issue, muscle weakness issue, or if you're just, you need to just open up. And it seems like you're very active as well, right?
Yeah.
You probably get up and you do a lot of things throughout the day.
Yeah, and I go to the gym every day, and
Nice.
I walk, and walk and gym is my main exercise.
Got you. And then,
but I have to just lay down, and
once a day, typically?
I had to lay down at 3-4 p.m. because the back hurt.
Got you.
And it'd be wonderful if I didn't have to do that anymore.
Got you. Let's see the leg strength. So I'll start over here, and it's diffused on both sides.
Yeah, all the way across the back, the middle back, all the way. If it was hurting.
Okay, cool. So let's do this. I'll have you kind of kick out into my hand as hard as you can. Very strong. Break. So push out for me. Good, strong. Break. You almost kicked me away. And then we'll come over here. Can you come up and meet my hand? Just
okay,
a march.
Sure.
Just a little march for me. Hold it there. I'm going to push down. Don't let me push. Good. And then break. Good. Strength is good. Any pain in the back with that?
No.
Same thing
here with that.
Come up for me. So push. Good. Break off there.
Just there hurt.
Yeah, that's what I'm going after. Hip flexors. So let's I'm gonna do here. We'll check out the glutes, but I prefer to do it in sideline. I'll have you push out in my hand. That's super strong.
I do that exercise at the gym.
Good. Now push in.
I do that one too.
Then break. I'll have you. Are you comfortable sleeping on your side?
Yeah. This morning I slept so deeply on that omnitrope. My shoulder hurt. That's a little deep, a little too much sleeping.
Yeah. Let's check out the shoulders too. Let's see how they're looking. So we'll come here like this. We're gonna switch it up. I want to check out the shoulder, so I'll have you hold here for me, both hands. I'm gonna push down. Don't let me move you. Okay. Push as hard as you can. So a little weakness at the shoulder. Break. And then let's see here too. Let's see you're right-handed?
Yes.
Good. Break. A little bit stronger here. Let's come here out to the side like this. Good. Let's push down. Little weakness there, huh?
Yeah, that hurt there, yeah.
You felt that in your back?
Yeah, I felt that there, yeah.
So that's kind of reproducing some pain. And then, boom, break there. Let's go here at the side.
That hurt the same spot.
The same spot, but that's in that region, correct?
No, that's lower.
Probably just because you're compensating a little bit to resist me.
Yeah.
But there is some weakness in the shoulder, so that's something I would definitely recommend. So look, when you come up overhead, and I'll stand to the side. If you want to get up really high, you have at some point here the shoulders work too, but the thoracic spine is also working. They work together, almost like when you do a bench press, your tricep is a synergist. So at the joints, you have the same kind of idea. The bones work together to acquire certain movements. So I'll have you bend at both elbows here. Let's check out the biceps, okay? I want you to push up for me. Good, strong. Now push down. Good, tricep and bicep are strong. And push up for me.
I do 10-pound curls.
And then come down. Good.
The smallest weights.
You did it today?
Yesterday.
Oh, nice, good.
I tried to go up to 12 because I'm on omnitropes.
Nice. Let's do this. I'm going to go external rotators now. So I'll have you back in that position and then push out into my hand here. Push, 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 push. Good. And then let's push in. That's pretty strong.
Perfect.
Yeah, sometimes that's fine. Push, push, push because you're using some forearm. And then push in. Good. And then break. Let's check out the glutes now. I'll have you on your side here. And I'm doing it really full screen, and when we're in the clinic, sometimes you've got a limited time and the patient shows up 25 minutes late. So we're not pressed for time here. I'm doing a little bit extra stuff. But that way you get more content for the video and people can kind of see what a physical therapy screen looks like. And I think most people will after seeing this, will realize it's not as bad as most people would think. So it's, physical therapy
great.
stuff is pretty chill. It's not anything too crazy.
Yeah.
So let's do this. I want you to pick up your leg like this. I'll have you straighten it for me. So just straighten it all the way out and then rotate a little bit. Can you hold it there? I'm going to push down. Can you push? Glutes are very strong. And then we'll rotate onto the other side. Sometimes with back pain, you see weak glutes too. But it doesn't seem like this is going to be her case. And strength seems to be there again, except for the shoulders. Good, break. Now I'll have you on your stomach.
I just a bad habit.
All right. Huh? Yeah, unfortunately, I'm testing pretty much. I've tested most of the muscles in the shoulder right now. I've looked at the muscles in the hip, the quad, the glute, just not leaving any room here. It might as well. We're here. We have time. Let's do a full screen. That way we can, even if we're not working on the back necessarily, we can give her some things to do. That way, the idea is that everything is kind of balanced. So upper body a little bit just right here on the delts. So this one here, I'm going to have you just gently pick up the leg. Can you hold that? I'm going to push. Good. Come down. Any pain?
No.
Same thing on the other side. And then let's push. Good. Break. So strength-wise, legs look pretty good. So this is what I'm going to recommend here. I'm going to have you do some exercises for your upper back. So here's what I'm going to do first. Have you done like prone cobras, things like that? So it's the cat cow. I guess they call it. It's not really a prone cobra. The cat cow is where you're here on your. Hopefully you can get me, but boom, and then you come up like that, just to kind of get some mobility through the upper back. And then you arch, and then you come up. So you would arch, and then you would come up.
Okay.
And see how that feels. If that kind of.
All right, we put the hair up so y'all can see my attempt.
I mean, she's very active. There's. Even you can do it on the table. You don't have to go on the floor. Yeah, on the table is fine. That way, I'll handle the floor. That way, you don't hurt your knees.
Okay, so I keep it flat.
And let's see. Yep. And then are you able to?
And then I
like
go like
a cat, and then come down. I felt a little crack through there.
Okay.
So a little less. You don't have to go so extreme. Just come up again. So we're gonna kind of come up into the cow position, and then just gently go down. There, and then come up for me. Good. See how we're kind of getting into that flexion
Feels
motion?
good.
Yeah. I think you're just stiffening up. I mean, you're on your feet, you're very active. And then come up, and then you can just gently oscillate back and forth. Just giving her some stretches that I think whenever she has these symptoms coming up that she can.
Oh, so if it hurts, I should do this.
Yeah, if this feels good, let's go for this one.
Feels good, yeah.
Yeah. Just to keep things moving too. And as you age, the spine, the best thing you can do, and I tell people because they come in and they're scared, oh, I have arthritis, osteoporosis, but the problem is that they're not doing anything themselves to fix the problem. They're sedentary, and that makes the problem 100 times worse. The best thing you can do at your age, I wouldn't let this injury.
Now doing this right here, I feel like some stiffness here.
Yeah, so the scapulas are going to be working. You're using these to support yourself now, which is good. Yeah. I need you to get the shoulder a little bit stronger and get this a little bit stronger as well, and through this region as well, because that should help your issues. Because if these muscles aren't firing appropriately, it's going to be hard to stay in extension. So I'm sure you guys are probably doing a lot of rowing and things at the gym.
I do the rowing, yeah.
Good. So you got the new MacBook. Nice.
You think of 5 minutes of doing this?
No, you can go about 10 to 15 repetitions as tolerated, and we'll come off of that. So the next one I'm going to show you here is I'm going to do it standing, but you can do it on your knees. So for the angle, for the camera angle, I'm going to face this way. But
You want up here first?
it's a thread to needle. It's very simple. So you come in like this. You'll be on all fours, and then you'll come in like this. Get a big stretch of the upper back, come back, and then you go through the other side.
Okay.
Come back. Boom. Just mobility stuff to get you opened up. I think that's more of the issue, that you're just standing for a long time and the joints they're compressing.
Yeah.
But it's nothing serious. Like, I wouldn't lose sleep over this at night. Like, that's what I like to tell my patients. The spine is very resilient.
Oh, that's great.
It has the ability to get
hear.
stronger. So a lot of people, especially with the spine, and I don't have a model here, they hyper focus on like, oh, I've got arthritis, or there's some bone demineralization. But at the end of the day, I mean, the spine in cadaver lab, for us to get to the spine, we had to cut through a chainsaw with a chainsaw. It's not going to break on you or anything like that. So how does that feel?
It feels good.
Yeah, and then you can come off a little bit, and then really just each time try and get a little bit more motion.
Okay. I want to stretch that way too.
Yeah, into extension.
What's that for you? Are you guys doing photos? Or?
We're on a live stream, I think.
Oh.
Yeah.
Okay. You know when I'm supposed to do her mic training. That's okay.
I don't know. We're pretty much almost done.
Okay.
You guys gonna record it?
Oh, you're okay. Sorry.
You're good? Yeah. Good. And then come back. How's it feeling?
Well, it's pretty much the same each time. I'm not going to get like further.
Yeah, and it looks
But
like there is a little bit limited mobility there.
It is tiring, yeah.
We'll come off, and the idea is not to tire yourself out. It's just to get some openings there.
Okay.
Let's do this. I'll have you come off for a second. And then
tiring is fine. Maybe that's good. It feels a stretch there. And
that's what I'm going after. But this is not going to be like a strength exercise. You're not going to build muscle doing this. It's just
that's fine.
But at the gym, the best thing you can do is continue with the rowing exercises up here.
Okay, the rowing. Okay.
And then the last thing I want to.
How high do you? I when I pull, it's about here.
Yeah, you can go low row. You can go mid row. That's going to be fine.
Yeah, I don't even know if there are different types of rows.
You have upright rows. You have mid rows. So depending on the way I tell people, right? If you're at the gym and you're doing a rowing movement, wherever your elbow's coming back, if your elbow's low, you're targeting lower muscles. Your elbow's really high up here and you're driving back, you're going to get upper back. For you want to kind of hang out in this range. So the row that you were doing,
I do here.
Yeah, that's going to be perfect.
Okay. But they have rows that are up here too. Yeah, I never do that one.
I would definitely recommend staying more neutral. Okay. That grip can be a lot more pressing on the shoulders because you're in more of an internally rotated position. So for some people, it can cause issues. But I mean, overall, your strength is there. The only thing I saw strength-wise was on the deltoids. So if you want to maintain reaching function, or like if you're in the kitchen reaching for a high cup, you can just do kind of front raises to strengthen the front part of the deltoid here. Some scaption, and then the last one that you had issues with was out to the side. So you would just strengthen along that range, but your motion is great. You have full range of motion. So you would take like a light dumbbell, 1-2 pounds, utilize that dumbbell, and then I don't really like to overcomplicate it. It's just a simple linear progression. So for those people who are in the gym, I know we've got some strength athletes here and some bodybuilders are in here as well. Really, the same approach works in physical therapy. There are physical therapists who try and do all kinds of crazy stuff. And at the end of the day, it's really simple. Just move a little more, get a little stronger. I think that's really the biggest thing.
So take light dumbbells and do more different directions.
Yep. And then the other exercise, and I can put something together in writing after, will just be keep rowing. The last thing I want to show you too is a couple wall stretches. Take one hand, you grab on the outside of a door, you kind of come in, latch on, and gently lean back. And you're going to get a gapping force as well. That's something you can definitely utilize. If you're at the gym, I like some of my patients to hang from bars just to get a little bit of that spinal traction. And then good. And just ease in. It's a big stretch, and you should feel a big kind of stretch through
here.
Yeah,
it feels good.
So just to open you back up, I think what's going on is you're very active, you're on your feet, and you stiffen up. Just like I would as well. I mean, if you're standing all day, you're moving around, most people are going to have issues with stiffening up. You can do both sides with that as well. So for this one, you would probably hold it about 30 seconds to a minute, and then just let the back kind of stretch out. Then you can do the other exercises and the stretches for the upper back, and then resume activity. Hopefully it should help out.
Cool.
The last one is if you're at the gym, do they have a bar?
There's
Or do
plenty
they
of
have like
bars,
a
yeah.
pull-up assisted machine too?
Yes.
You can maybe use that. It won't be as much weight on the shoulders, but you can kind of just get yourself, or even on a cage. A lot of gyms, they have a cage that you can grab onto and do the stretches there. Just kind of hold yourself up and let it just traction the spine a little bit.
Yeah, I never use that machine, so just set it on like 50 pounds or
And
something.
you wouldn't even do pull-up. You would just kind of hang out and let it elongate the spine. Because I'm not going to be here tomorrow. You know what I mean? So it's like there are different things you can utilize. That would be beneficial. And then the last stretch is to get the anterior portion. So I was saying it earlier in the video, but what ends up happening is patients, they'll get tightness. Because look, all of us are working in the world in front of us. Does that make sense? The world behind us, no one's reaching behind them to grab things. So these muscles in the front will typically get overstimulated, overused. They'll tighten up a little bit, and then that can cause posture to kind of come forward, which for a lot of people can cause issues at the back.
Yeah.
Or you have very heavy breast, right? You have like double D's, it's pulling you forward, then you'll see back issues in our females.
I just slouch, yeah. I'm
Yeah,
just a sloucher.
Like things like this, so I'll show you here. Just you can come up against the wall here. So we're going to go other side now. Arm will go here, and then you're just going to stretch out that interior compartment of your shoulder, so the front portion, just to get, and you're going to feel it in your back. I'm pushing my back into extension, and it should open you up a little bit. And you can even come down like this, and same thing. You should feel a pretty big stretch through here. So we'll ease in on that one. Let me get out of the way here. Good, and then just ease in because it's going to be a pretty big stretch. And then, yeah, you can already see the muscle elongating there. So that's what we're going for.
Yeah, that's kind of odd, yeah.
Yeah.
And then
you can try it lower as well too. The goal is to target the pec. So I would extend the arm, like lock it out. Good. And then for you, you may have to rotate a little bit. You're a little more flexible than me. And you should feel it all through here.
feel it through here.
Yep, good. Just ease in, don't overstretch it, because the way I explain it to people is when you don't stretch a muscle, it responds the same way as your gums. So when you go to the dentist and you haven't flossed your teeth in a while, and then now the dentist is punching at your gums or flossing everything, they bleed. Muscles are live tissue as well. So if you go out there and now you decide that you're going to start stretching the living crap out of the muscle, what's going to end up happening is you're going to stiffen up, you're going to be in pain. That's why some people, I recommend just easing in. Don't ever overdo anything. Just lighten it. Start easy. You never want to jump deep into a stretch. Always try and get a little warm up as well, and then get it done, because a lot of people, they sleep on it, and then that's why they stiffen up. So, but yeah, other than that, I don't have too much more. We'll probably talk a little more behind the scenes, but I just want to say thanks for having me on cam.
That was great, Peter.
Happy to be here. Yeah, on the fly. You put me in the spot. I haven't done this in a while, but this was fun. Yeah, I haven't done these videos in a while. So, perfect.